Dear Chairman, distinguished colleagues, I'm Professor Said Norou from Dakar, Senegal, former medical director of the Diabetes and member of IDF Africa. Distinguished colleagues, it's my pleasure to be part of this important conference and have to speak about methods and challenges for preventing of diabetes in African countries. As you know, improving health through good health policies is an important target of the Millennium Development Goal. Diabetes is a priority disease that needs to be addressed to achieve the Sustainable Development Goals target of reducing premature mortality from non-communicable disease by 1/3 by 2030. Prevention is an essential challenge in our African context, our African countries, but we have to learn what method of prevention and what challenges are ours to address the specific progression factors of the disease, diabetes. What is the problem? If there is any problems and needs for Africa, but we need to have a better understanding of the burden in the world, better knowledge of diabetic in Africa, and we have to deal with particular risk factor. We are going to talk about them. And awareness and affordable tests for the early diagnostic of the disease are essential in our context. And the challenge is making the right choice for prevention and management of diabetes in African countries. The main goals for myself are controlling the risk factors, knowing them, screening of diabetes and earlier, early detection of new cases with how and whom, and putting adapted management of the disease in our countries. As you know, for Africa, we face the double burden of the disease. The the sub-Saharan region is undergoing a rapid epidemiologic transition and double burden of the disease. We have faced communicable disease such as HIV, tuberculosis, but the risk of non-communicable disease is an evidence in our concept, and diabetes is in Africa a huge and growing problem now. This situation is fueled by the pace of urbanization and other environmental modification. As the IDF Atlas 2005, there are many highlights. One, the increase of diabetes between 2004 and 24 and 2050 will be at 142% increase, and the highlights interest impaired glucose tolerance, impaired fasting glucose, and undiagnosed cases of diabetes. There's a 72.6 undiagnosed case now in our context, and it's important to reinverse this. That's why we have to know other progression factors of type 2, particularly in Africa. And the main risk factor to address are obesity and metabolic syndrome. It's the paradox of our countries, because these are countries where malnutrition is present, but because of urbanization and overeating, we see the development of obesity, and because of that, there's physical inactivity, and cultural factors are yet important. Yes, there is a positive connotation of obesity in many of our countries. Effectively, a larger body size in women may be associated with affluence, health, attractiveness, and happiness. And the other hand, we have the problem of ignorance. Ignorance. In traditional medicine, chronic disease is not accepted. And there's many myths and misconceptions and beliefs about chronic disease as diabetes. And there or as a particular socioeconomic data in our context. Firstly, the lack of diabetic center or units doesn't exist in all African countries. The lack of qualified healthcare deliverer and equivalent. There are many difficulties in patient management and monitoring, and awareness is not yet well developed, and we have any financial problems for it. Because of that, investing in awareness would be essential in our context. How? By combination, firstly. We have to promote global health and population by good information. We develop awareness for better knowledge of diabetes, its risk factors, and early symptoms. And education, we have to put education on myths and beliefs about diabetes. We have to involve for that traditional healers in our program of awareness about diabetes and chronic disease. And we have to put adapted healthy nutrition programs and exercise programs in our communities, in schools, in advert, etc. And we have to put special awareness programs during a celebration of the World Diabetes Day or the World Health Day. In communication, it's important for us to put actions based on communities by involving leaders of the communities, traditional of the religion and religious leaders. Social organizations in the community have to be involved, including women, young leaders, etc. And we have to work closely with social medias to share all this. And the mobility of diabetic association is a main important thing in our context. And we have to discuss with corporates for the engagement, and we have to have the commitment of pharmaceutical companies and pharmacies. The challenge too will be able to improve connects and practices for healthcare deliverers with adapted means. That's why we know that HCPs must be trained and organized as teams. Training must be one of the great objectives in national programs against diabetes. Training programs from IDF Africa must be largely shared, involving healthcare delivery in awareness and schooling diabetes programs. Training manuals for diabetes education and physician have been developed. You see it here. And healthcare programs have to be motivated in all needed actions. Or as action to be implemented by states will depend on local context. We have to put gradual implementation of training programs, adaptation of manuals and protocols to the local context, implementation of appropriate awareness and early diagnostic tools for diabetes. We have created diplomas on diabetology and endocrinology in our departments of medicine, and we have put it since 20 years online training like e-diabetes and masterclass on diabetes and M-diabetes program for Senegal. Early detection of diabetes is one of our objectives, and we have to choose opportunity targeting population at risk that will be more cost effective in South Africa. And for that, we have to use fasting plasma glucose is quite simple and cost effective. At the level of organization, we have to learn from best experience in some of our countries like Senegal, Cameroon, Nigeria, etc. People live Cote d'Ivoire, etc. People living with diabetes will have to be at decision-making tables to ensure work undertaken is focused on areas where action is most needed. Resources mobilized for diabetes program have to be secured and optimized by involving parliaments, diabetic action measures, etc. Developing more of our South-South cooperation is essential, and we will be a good point of discussion in this kind of Congress. That's one of the program of WHO. Thank you very much.